now we have Dr. Nevil Chimon, who's the Chief Business Development in Asia at Dr. Smart. He is a leader in drug discovery and diagnostic healthcare who has helped transform how drugs are tested by using molecular imaging to save tens of millions of dollars for big pharma. He's going to be talking about blockchain in healthcare. Can you please give him a very warm welcome to the stage?
Good evening, everyone. So I'd like to introduce and talk about Dr. Smart, which was designed by healthcare futurists to deliver medical solutions today. So the healthcare market's enormous, it's got tremendous potential, and it's currently growing. Why is it growing? Because people are living longer, and you've got an aged population that needs the management of their chronic conditions, their illnesses, and this is driving up healthcare costs. We're interested in a specific target in the market, which is the ambulatory patients or outpatients, people who can get from A to B, and they're being told to go to centralized clinics and receive healthcare. So what's our idea? Smart technology, smart devices are giving us the opportunity to decentralize healthcare, bring the service providers to you. So the industry needs to change, this much is for certain. It's a large behemoth of bureaucracy and costs that are associated with large infrastructure. What patients want is they want access to their information. This is the critical component of healthcare, that you have transparency in the services that you buy. But the most important thing too is you have a situation where patients having a very transactional relationship. They're going to their clinics and they'll be treated for a specific symptom rather than the underlying disease. So already now you have healthcare using advanced digital technology to improve healthcare, certainly in the form of telemedicine, which our founders are experts in. They've developed that technology, they've implemented it, and they know how to use live stream video with the correct training of their physicians to extract the best out of that consultation. The big advance that digital healthcare will make use of is really artificial intelligence. There's a huge mountain of healthcare data that can be mined with raw computational power that's provided by Gigawatt in our instance, to make use of trending information that can tell us more about health outcomes. When you go to your clinic and you get treated, how efficient is that whole process? That's what we're interested in, using AI systems to improve outcomes. So, global corporations, they're already trading, dealing with healthcare data. This is a fact. We want to wrestle control of your healthcare, private, confidential information, and bring it back into your control. Dr. Smart is designed to do exactly that. So, the advantages of our solution: how do we deliver a better healthcare experience? We provide accessibility to your physician on demand. Affordability: we're not paying for the large infrastructure around hospitals, you've got a lean system. Transparency in terms of cost, you know, through an itemized billing system, how much each of those services has cost you, and we have a rating system so you know the quality of the physicians. Usability is all about the app that's very simplified and delivers you a simple go-to solution. So how do you use our app? How do you use Dr. Smart? It's very simple. You download the app, you activate it, you select the medical condition that you have, you select the specialty doctor that you'd like to see, and the smart queuing system will find you a doctor almost immediately so you can begin your live stream video consultancy. The doctors are trained to make full use of this opportunity. And you will be able to discuss interactively with your doctor what your problem is. And at the end of that session, you'll have a recommendation or permitting a digital signed prescription to treat you. You will be giving a rating scale for the doctor, and you'll be giving a rating scale for the Dr. Smart experience. Easy. So this slide's a little bit busy, so I'm going to take a little bit more time to explain it, but this is, in essence, what makes Dr. Smart unique. There's other telemedicine providers out there, but they're not trying to create a global, holistic ecosystem. Of course, in a hospital infrastructure, you've got various departments, and to create that same synergy, that same capability, what Dr. Smart does is it has offline partners that provide clinical diagnostic capabilities. It could be MRIs, provides laboratory services, which could be blood tests, wellness centers, which are providing physiotherapy, and integrates all that information into our own medical cloud, where we can capture that information, send it back to our data bank, and use AI to mine that information. Our data bank is unique because it contains an open source link whereby we have regularized and validated control data sets, which external partners can use to help create, validate, and monitorize their own AI technology. This is an inclusive system. It's not an exclusive system. We're not trying to create algorithms that are better than other people. We're trying to bring them into our system to utilize their knowledge and capability to really drive an ecosystem of growth and precision in medicine. If you see on the far right there, that's our SQ module. Basically, that's our smart queuing system whereby the doctors can directly connect up with the patients and give you a fast service. The DSS is a decision support system, which is AI-driven, so that when you're having a consultation with a physician, they can have access to your historical medical records, even your parental medical records, and look to see if anything's flagged back in the past that accounts for your medical condition right now. If the diagnosis is difficult, the intuitive system, which is part of our AI, will help the doctor ask the appropriate questions to extract the maximum value out of the consultation. With the advent of wearable technology, you have a huge preponderance of physiological data now in the forms of heart rate, in the forms of ECG, pulse oximetry, and this can be brought in, incorporated into our database, mined with AI to remove artifacts and have high-quality data that can, again, produce a more holistic view of your health. We want to know the overall health of you so we can predict problems that may occur in the future, rather than just prevent them. So how do you get this wonderful service? You use a DSTT. It's an ERC20 token, so you know it fits the standard for smart contracts using the Ethereum system. And of course, it's a digital right. It's a digital right to provide privileges, membership, and to a loyalty scheme. So how does Dr. Smart really deliver value? Where's the value add? We know that healthcare costs are accelerating. We know that as people live longer, they need more healthcare. Those are well-known facts. But it's because we align the stakeholders that are involved in this process of healthcare. We have the healthcare consumers who are always looking to increase productivity. So when we connect with our hospitals and our clinics, we drive their productivity. With insurance companies, they're able to reduce costs because the infrastructure necessary to support our operations is less. And of course, our customers themselves are able to extract the best service available with lean operations. And of course, the node providers who are supporting our network to ensure its speed get compensated for this process. Currently, we've developed an MVP, and we'll soon be going to alpha stage. And we're targeting rolling this out after we've refined the system and have it totally operational and perfect. Then we can target countries who spend a larger proportion of their GDP on healthcare. Our team is inspirational founders who have got a strong background in IT and medicine. Our global business development team are individuals who've been involved in healthcare for a long time and have rolled out systems in multiple continents. And our advisors are experts in strategy, ICOs, regulatory affairs and governance, and medicine. Our partners as well provide the medical expertise in telemedicine, which is the bedrock of our service. Cryptanonymous is supporting our ICO, and the sheer computational horsepower required for AI analytics is by gigawatt. So right now, the DSTT token is available on a private sale until May the 15th. We believe that a hard cap will be achieved because everybody needs healthcare. So, the ultimate take-home message for us is healthcare needs to be done differently, and it can be done differently now. So, purchase our tokens. Thank you.